All right, welcome everyone to our first local food virtual town hall for 2025. Happy Kansas Day to everyone. Um, Great opportunity to talk about feeding all of the residents of the state of Kansas on Kansas Day. I'm Rebecca McMahon. I'm the Local Food System Program Administrator for K-State Research and Extension. And on behalf of our local food team, we'd like to welcome all of you to our town hall and thank you for taking time out of your busy schedules to join us. So we are continuing this quarter with a slightly different format where we only have two lightning presenters. I don't think you're going to miss the extra lightning presenters at all because we've got such great content from our two presenters today. Our agenda for today is our lightning presentations are talk about food as medicine from Carly and Kelly with the Sunflower Foundation. And then the K-State Urban Food Systems Initiative will be sharing about their new research projects that are collectively kind of looking at the development of resilient urban food systems. So I'll let them share more about that project as well. Per usual, we're going to give you some of our RFSP grant project updates, a few updates from the Heartland Regional Food Business Center, and then there'll be an opportunity for discussion and announcements of other local food system efforts going on. Per usual, we do like to do a little bit of evaluation with our town hall. And so our welcome poll, I'm going to launch that here for you, is just asking if you've attended the town halls in the past, and also the part of Kansas that you live in. I'll give you a couple minutes to work on that. All right. So just so you can kind of all see where we're at this point, a good percentage of you, 63%, have attended multiple times, which is great. And a few, this is your second, and then a number of you, this is your first time. So for those of you that are brand new to our local food virtual town hall, welcome. We're excited to have you with us. And locations, so we're pretty well divided around the state this quarter. So still looking for some folks from Southwest to join us, but we'd love to see a few more folks on the town hall. I know we've got a lot of other meetings going on across the state today as well. So thanks for those of you that saw on the slide to add your name, location, and organization or business into the chat. That is so helpful, especially for our speakers to kind of understand who they're talking to and who's on the call. And is also a great way to help with some networking, if there's someone that you want to connect with after the call is over. So with that, we are going to jump into our first lightning presentation today, and I will introduce Kelly Mark and Carly Huchin with the Sunflower Foundation, and they are going to share a little bit about what is food as medicine and what are some things that they have learned from doing a pilot project to start out. So I will turn it over to them. Feel free to unmute and just let me know when you want me to advance the slides.
Great. Thanks, Rebecca. Good morning, everyone. I am Kelly Mark. I'm the Director of Healthy Communities at the Sunflower Foundation. With me today, as Rebecca mentioned, is my colleague Carly Houchin. She is the Director of Health Systems at the Sunflower Foundation. And we're super excited to share with you some lessons we've learned from Sunflower Foundation's pilot Food as Medicine project within FQHCs across Kansas. Next slide, Rebecca. So first, I wanted to start just with what is food as medicine. So there's lots of different definitions of food as medicine. Lots of people mean very different things when they talk about food as medicine or food as medicine. And just to kind of ground us today, because right now food as medicine is really a buzzword and lots of people are talking about it. Sunflower uses the Aspen Institute of Food and Society's definition of food as medicine, which really touches on food-based interventions with a direct nexus and or integration with the healthcare system, super important. Nutrition as a primary tool to prevent, treat, or reverse diet-related chronic disease. And in addition to food as medicine interventions include nutrition education, food literacy skills, resource referrals, lifestyle change programs, and peer support. So just to touch back on a couple of really important parts of that definition, a direct nexus with the healthcare system is super important. These are food-based interventions, so not supplements, not pharmaceuticals, but fresh whole food. And that food is used to actively treat and prevent disease right now. Another thing I want to point out is food as medicine programs are important advancers of health equity when you talk about access to fresh, healthy food. Next slide, Rebecca. So one of the first things we learned in this pilot project is that it really does take a village to develop a food as medicine intervention in an FQHC. We found that the most successful programs have a real program champion. They have invested providers and they really embed that program into their clinic workflow. It takes lots of partners, such as the local food system, community nutrition educators, a physical space in the community to hold cooking classes or nutrition education, and it takes access to healthy food. Currently, all of the clinics we work with get some or most of their food from the charitable food system in Kansas, as well as lots of other interesting partnerships they have in their local communities. So I talked about that nexus with the healthcare system. Food as medicine exists between two very complex systems. So you have the healthcare system, which is super complex to navigate as a patient, as a provider, as an administrator. And you also have that local food system, which can also be really disjointed and have a lot of barriers to accessing that nutrient-dense, healthy food that it takes to maintain that positive health status. We're focused on that nexus between the health system and the food system because one, we know science tells us that healthy food can help treat and prevent chronic disease. We know that. But in order to pay for these food as medicine interventions, we feel like the health system is really going to be our best bet in being able to get those things paid for. Next slide, Rebecca. So another lesson we learned that in order to have a successful food as medicine program, clinics really need to have provider buy-in and clinic system change. So this slide shows a quote from a provider interview, what was conducted by our qualitative evaluator, Dr. Susan Harvey. It's super important for clinic providers to buy into those programs, to support the programs, to refer into the programs. And it's also imperative that clinics really embed this program into their clinic workflow, get it into their EHR, get it onto their screening forms. Okay, this is a lightning round. I'm going to pass it off to Carly and she's going to finish this out.
Okay, so if we can pop over to the next slide. The next lesson learned that we wanted to share with you all is that in our experience working with the cohort of clinics, it can be challenging to identify the patients best suited for a food as medicine intervention. And this isn't necessarily surprising. This aligns with what we learned in a national literature review. There's tons of information about how effective food as medicine can be, but less information about how to implement a food as medicine initiative in a way that maintains fidelity and can be expected to maintain those high impact outcomes. So for example, most clinics that we're working with have identified diabetes or pre-diabetes as a qualifying condition to participate in the Food is Medicine initiative. However, they found that it perhaps is not the most effective option to only work with their patients who have, say, an HbA1c above 11. Many of those patients might have other health-related social needs that preclude them from participating in a Food is Medicine intervention successfully, and it might be more important to address some of those other needs, such as like stable housing first before they're enrolled in a Food is Medicine initiative in order for them to successfully meet their goals. Also, it's important for Food is Medicine program participants to be interested and willing to engage. So our clinic partners have also learned and shared with us the importance of screening for patient interest in addition to the qualifying health conditions. What you see on the screen here are some of the baseline demographics of those who have participated in Sunflower Foundation funded Food is Medicine initiatives. If we can hop over to the next slide. A very exciting lesson learned to share with you is that we are able to see and measure very positive health outcomes. So a couple of those are listed on the screen here. Just want to highlight a couple. Not surprisingly, in an initiative that provides food, we have been able to measure a decrease in food insecurity. However, what's really exciting about this decrease is that we've also been able to document an increased connection to the community food resources available to them. So many people getting enrolled in SNAP or WIC for the first time, or making connections to sources of community resiliency that allow them to continue to access food beyond the end of their participation in a Food is Medicine cohort. Happily able to document improvements in hypertension and the kind of glowing gold star that we were happy to see in some of these preliminary evaluation results is a consistent decrease in that A1C, as again, people with prediabetes or diabetes have been the primary qualifying condition of those participating in this initiative. If we can hop over to the next slide. Wanted to share another quote from our qualitative evaluator. This is from a program participant. I won't read it word for word, but we did just want to share the lesson learned or the reflection here that the impact of the Food is Medicine initiative, yes, includes health outcomes, but also includes many things beyond that that are somewhat immeasurable. And these outcomes are more than just numeric. They are people and Kansans, and they are our neighbors. So this gentleman who participated in the program, his occupation is that of a farmer, and he, due to his declining health, hadn't been able to crawl up in his tractor for a couple of years. Through his participation in the Food is Medicine initiative, he was able to make a couple of lifestyle changes, cutting out sugar-sweetened beverages and implementing some mindful eating practices like going for a drive instead of eating food in the evenings when he's stressed. And the week before Dr. Harvey interviewed them for this for the qualitative evaluation, he was able to crawl up in his tractor for the first time in a couple of years. So that was a really encouraging story to hear, because it really demonstrates well that the impact of this intervention goes far beyond what we're able to measure clinically. This is something that really improves the quality of lives of individuals. And then we'll hop over to, I think, my last slide, and just wanted to share a lesson learned about paying for it. It's perhaps ending on a little bit of a downer note that paying for Food is Medicine is challenging right now. It's primarily dependent on philanthropy. However, there are many exciting things on the horizon. So there are healthcare payers that are piloting efforts on different scales around Food is Medicine initiatives. There are a couple of federal grants that have gone to Kansas in the past couple of years to fund Food is Medicine at a really exciting level. And there's a ton of interest from academia to continue to study this work and continuously demonstrate its value. So not a totally bleak way to end, because there's a lot of really exciting things kind of in the pipeline that we're optimistic can become sustainable funding sources over the next handful of years. I think that is our last slide beyond the next one, which perhaps I think just includes our name and contact information. We can copy that into the chat as well, and would be happy to continue these conversations with anyone who is interested to do so. Thanks so much.
All right. Thanks, Carly and Kelly. So if you have questions for Carly and Kelly, we will do the Q&A after both of our lightning presentations are over, but feel free to interact with them in the chat. You can put questions in there, and then we'll do the live Q&A here after our next presenter. Okay. So with that, I am going to turn it over to Carrie Rivard. And Dr. Carrie Rivard, he is our state fruit and vegetable specialist for K-State Research and Extension. And he is going to share with us more about their Urban Food Systems Initiative.
Good morning, everyone. Thanks for joining us today. Basically, Rebecca asked me to come and sort of give a quick overview on this GRIP project that we received, and I'll explain what that is here in a second. So we're going to just sort of take the high-level viewpoints and try and give a quick overview. If you have questions about the specific research and projects, feel free to reach out to myself or Dr. Pliaconi. Eleni is the lead PI for this project. So this is basically funded by a grant that was provided by Kansas State University within the Office of Vice President for Research. My understanding is there was somewhere close to 40 groups of researchers put in proposals, and we were fortunate enough to be one of 3 that were awarded for this grant. And it has a lot of different aspects to it. Okay, next slide. So one of the things that's really fun about this project is we actually have 22 PIs from 16 departments in 6 colleges across the university. So it's a very diverse group of researchers that are diving into this world of urban food systems. And then the other thing that's great about it is we have this awesome advisory board that we're able to put together. So I'm not going to read all the names here, but you can see certainly a few familiar names from Kansas and the Kansas City region, as well as some others from regional and national specialists. Next slide. The other aspect of this project that I really enjoy a lot is we were able to write a whole lot of graduate research assistantships into this project. This is a $1 million grant. Typically on a $1 million grant like this for USDA, there might be 3 or even 4 graduate students. For this one, there's 12. So we really wanted to increase the number of students that are here at Kansas working on urban and local food systems. And you can see in the slide that these students aren't just in horticulture, they're in other departments like computer science, regional community planning, agronomy, economics, and entomology. The other thing that I would just mention is that the students that are outside of horticulture are all getting a certificate in urban food systems. We do have an interdisciplinary certificate program within the initiative in urban food systems that basically any graduate student at Kansas State University can take, or a professional student that isn't looking to get a master's degree can also take this certificate. And it's a 12-hour certificate. So if you have any interest in that, let us know. Okay, next slide. So one of the key components for these GRIP projects is that they wanted them to be extremely transdisciplinary. And the charge that was given to us by the VPR's office was really to assemble transdisciplinary teams in order to tackle, modern day challenges. And, food systems, urban food systems, local food systems, as we all know here, it's a very transdisciplinary area, and it includes lots of challenges across the spectrum. So in this slide, we sort of tried to capture some of the different areas of expertise that we have within our team, as well as some of the challenges that we can address with this expertise. But our long-term goal is to conduct work that can result in transformational change to address food security. So it's not just growing more food, it's not just making more food accessible, it's trying to do all of those things as a transdisciplinary team. Next slide. So I get this question a lot, especially being a initiative within Kansas State University. Why are we talking about urban food systems? And I think it's really important to point out that in real life, not just academic departments, we live in a continuum from urban to rural communities, and that continuum is very widespread across Kansas. more than 70% of the citizens of Kansas actually live in urban environments, which is a statistic most people don't realize. But one of the things that we try and communicate in the proposal and through the work that we do is that things that happen in urban communities have huge impacts on rural and peri-urban communities. And in general, contributions of both rural and urban communities are widespread and tend to touch each other in lots of different ways. So one of the things that we wanted to do was to be able to document these contributions that, in our case, urban agriculture is making, not just on communities in urban areas, but also in rural areas as well. Next slide. So this slide basically just shows the overall objectives for the grant proposal. I'm not going to go through all of them today because this is a lightning round, is my understanding. But I did want to kind of focus in on the first three because I think those are the ones that are probably most interesting to you all here. So next slide. So our first objective and sort of the capstone part of this project is really to do this assessment or evaluation of different urban ag types. So we think of different ways that food is grown in cities. That can be anything from a high-tech greenhouse or vertical farming system to a community garden. And again, there's this wide range in between. So we've identified 7 categories that we're trying to assess the contributions that these sites make not only towards agricultural productivity, but also community health, environmental sustainability, and food system resiliency. So we actually have 4 working groups out of our 22 PIs divided into these 4 categories, and we have a graduate student working on each one of those categories. And so we've been working very hard, especially the last 12 months, on this aspect of the project. I'm happy to report we've developed all of our surveys. It was actually quite a bit of work to do that. They've been beta tested with our advisory board as well as by myself here at the OREC. And we just submitted an IRB. So we're planning to start collecting data probably next month, hopefully, and working with some of the sites to start doing our interviews and surveys. Next slide. So what will we do with all this data? We're planning to collect, again, very thorough amount of data from 21 different sites across Kansas and within the region. And our goal is we're working with the computer science and mathematics folks to develop predictive modeling for urban food systems. So, we all love AI these days, and it's really fun. I can go online and, ask AI to make a picture of me if I was a cat and what that might look like. And that's really neat, but our goal is to be able to use AI to basically take publicly available data, things like demographic data, public health, economics data, and then ask Alexa, what happens if we put a community garden in this spot right here in a city? Or what happens if we put a school garden in this district of Wichita? How is that going to contribute to the agricultural productivity, the community health, the environmental sustainability, and the food system resilience for communities in that area? So that's the long-term goal for those 2 projects. And it's been a lot of fun working with the folks in computer science to learn more about how that works. Next slide. The last thing I wanted to touch on were these urban ag innovation projects, what we lovingly refer to as seed projects. There are 7 of them that are included within the project. I'm not going to talk about all of them, but I just wanted to do a brief overview of the different types of projects that we're doing. Next slide. So one of the things that we're really interested in this group is trying to identify agricultural production systems that are integrated with civil engineering or otherwise, things that are happening within cities or places where we have this collision of agriculture and communities. And one of those is certainly agrivoltaics. So the idea with agrivoltaics is, what happens when we start putting up solar panels all over the place? We lose a lot of agricultural productivity. And so the concept is maybe we can grow crops within our energy producing farms in order to get both the agriculture and the energy production from that site. So we've been able to develop quite a bit of data. Actually, we built this site in the bottom right-hand corner here at the OREC using a 90-degree fixed mount system. We've also been working with Evergy and Free State Electric Cooperative to do light characterization studies in Lawrence and Topeka, looking at their uniaxial tracking system based technology. Next slide. Second project that I think is a lot of fun is led by Dr. Tanya Kim in the entomology department. And Dr. Kim is an ecologist that's done a lot of really cool stuff over the years. And what they're doing is actually looking at the abundance, the diversity, and the functional impact of different types of insect ecosystems across urban and peri-urban and rural perspectives. So she actually has 2 students working on this right now, and what they've been doing is sampling insects across 16 farms in the region, and they collected data both in 2023 and 2024. Next slide. And then last but not least, I wanted to mention the Carrot Project. This is led by Dr. Tricia Jenkins and Becky Stoutville over at the Olathe campus, and they have a graduate student named Dustin who's doing this work. The Carrot Project is actually a community and agriculture resilience audit that was developed by the North American Food Systems Network. So this is an established assessment protocol that's already been developed. And their idea is basically to take this protocol and do a community and agriculture resilience audit, in Kansas City, Kansas, and Kansas City, Missouri. So she's been working closely with folks there to do interviews, collect surveys, all the things that are associated with this audit in order to understand better how resilience exists there, and also especially how it relates to food system policy. Okay, last slide. So that's all we have. I'd be happy to answer any questions when we get the opportunity for that.
All right, thanks, Carrie. So we have had several questions in the chat. So I'm going to circle back with Carly and Kelly and give you the chance to speak to a couple of those out loud for the whole group and for the recording. So I think the first question was from Tom asking about if you see opportunities for expanding food as medicine with the Make America Healthy Again caucus at the federal level, what's going on at the federal level with this.
Thanks, Rebecca. Lots going on at the federal level, so we're super excited about that. We've been meeting with the National Food as Medicine Coalition, and of course, they are very targeted on everything that's happening across the nation in food as medicine. They're working on or closely watching any federal policies that are happening, and really glad to have a partnership with them. There is an official Health and Human Services Food as Medicine Toolkit that's super helpful, has lots of great resources in it. There is just a lot of excitement at the federal level around food as medicine, and that's good to see. There was a congressional briefing done by Tufts University on food as medicine and their use with GLP-1 medications, which got a lot of buzz and was really interesting. You can find that on YouTube if you want to watch it. It was super interesting. And there's also been some federal bills introduced that we're watching closely to see what's going to happen with them. But Carly also mentioned that Senator Marshall is the co-sponsor of the Medicare Medically Tailored Meals Demonstration Act. So we're keeping a close eye on that. So really there's a lot of energy around food as medicine. There's a lot of people talking about it. Definitely at the federal level, and we feel like food as medicine is going to have a place at the table federally in the future. So pretty excited about that.
Thanks, Kelly.
Yeah.
So kind of following up with the policy discussion, Natasha had a question about written policies that help to embed the work in the healthcare partner systems.
Yeah, I can
shared some links. Carly, go ahead.
Yeah,
Carly.
I can take that one. So our grantees don't necessarily have policy, like organizational policy documents that we could share. They worked through a planning process and so kind of have more informal policy structures there. But what I linked to is the HHS Food as Medicine Toolkit. If you go to their website and click on promising practices and tools and then state healthcare structures, direct link in the chat, but saying for the benefit of the recording, that will take you to a dashboard that shows you the different policy approaches that different states have taken. Primarily, people are utilizing Medicaid 1115 waivers. Many of the Medicare Advantage plans now being offered include a food as medicine benefit, different uptake in those plans from state to state. And then the other thing is Medicare now pays for community health integration codes, and we think those show promise as a way to utilize the traditional healthcare reimbursement system to pay for some staff time to administer food as medicine. So things in the works. 1115 waiver probably not going to happen in Kansas anytime soon, but helpful to see what some of the landscape looks like nationwide.
Thanks, Carly. Okay, question for Carrie from Aaron, asking about, as part of the home gardens, did you look at small animal or egg production?
Yeah, so I mean, we're really just starting that work now and started in terms of data collection, but yeah, the ag productivity group is including not only just horticultural crops, but livestock, eggs, beekeeping, any type of agricultural product.
Thanks, Carrie. Are there any other questions for our presenters? If you want to unmute.
I have a question. I'm curious for our food as medicine friends, if I wanted to support a clinic in my town or area that I knew was actively involved in this initiative, how would I know? Is there a way to know what clinics are participating in this? Yeah.
Yeah, so there's 6 clinics currently doing food as medicine work in partnership with Sunflower. There's others kind of piloting efforts around the state. So this list is not comprehensive, and really, I think it's always great to maintain relationships with, like, say, the federally qualified health centers in your community. But the 6 that Sunflower is currently working with are Health Corps, Genesis, Heartland Community Health Center, Hoxie Medical Clinic. Kelly, I'm missing 2. Oh, Community Health Center of Southeast Kansas. I did not go in order, so I'm not sure which one I left out.
Did you say Heartland?
I think I did. Amanda, I'll drop them in the chat for you, as I no longer remember which one I skipped.
Other questions? I'll throw a question out to you, Carrie. So if someone across the state is interested in any aspect of your project or research, what's the best way for them to, learn more? Are there opportunities for public participation? Are you looking for more research sites? Are there other opportunities to get involved or to hear about the research outcomes when they're available?
Yeah, that's a great question. So we do, I think somebody posted a link to the website for the GRIP project. That website is brand new. It was just put up a month or so ago. But that's a nice place to just get an overview of what's happening, and has contact information for most of the PIs and things that are happening. In terms of the sites themselves, we have a list of, I don't know, gosh, 30 to 35 sites, and we're in the process now of reaching out to folks at those places, and we're going to narrow it down to 21. One of the things that I think a lot of folks don't understand is, like, you have to be pretty good at record keeping to be able to help us with this project, documenting all those impacts, especially on the economic side. Takes a fair amount of lead work in itself. So we're expecting that some portion of the folks we reach out to are not going to be able to help us with that. But certainly, if you know of a site that would be interested in participating in the assessment tool, feel free to reach out to myself or go on the website. Simra Fedahovic is our Urban Food Systems Initiative coordinator. So if you send a email to Simra, she would definitely help to figure out to make sure it gets in the right place.
All right. Thanks, Carrie. So I think our presenters will be sticking around for a little bit longer. If you do come up with another question, feel free to drop that in the chat. And with that, we are going to move forward with a few updates from our K-State Research and Extension programs. So one of the things that we want to just provide a quick update to everyone is about our local food producer workshops. These are coming up quickly. Our first workshop is Friday in Manhattan and then Saturday in Wichita. So we've got 6 of these workshops scheduled around the state. These are really targeted at our local producers. So local farmers, local food businesses, and particularly those that are selling direct to consumer, although the flavor of each workshop is a little bit different. So you can check out our website and get more details about the agenda and speakers for each location. And we are still taking registrations for all of those workshops. We also have the grant writing basics for local food system partners coming up. Oh, this doesn't have the correct dates on it, does it, Amanda? I didn't change that from our October slide. So the correct dates are actually February 10th and 11th, not January 21st and 23rd, which would be over already. But the cost and time is correct, $60 and 1:30 to 4:30 p.m. Just February 10th and 11th is when those are going on. The next announcement is exciting. We are getting ready for our 2025 Kansas Local Food Summit, and we are giving you a save the date notice for July 29th and 30th. Exactly what's going to happen on which day, which day is the primary day, we're still sorting out, but that'll be end of July at Kansas Wesleyan University. We're excited to partner with their Community Resilience Hub and all the great efforts happening in Saline County with local foods and food access. And so we will be visiting there and hopefully seeing many of you there in July. Our town halls this year are the 5th Wednesday of the month in each of 4 quarters. So all of you are here today, so you are registered for all 4 town halls. We have one registration link for the entire year. You will notice that our July town hall is also scheduled for the 30th. So exact plans TBD. Hopefully we're all together in person in Salina rather than virtually on a town hall. So we may end up canceling or shifting the date for that July town hall. But if you've got others that you think would benefit from joining, please feel free to share the link with them. As always, if you're not on our mailing list, I think the vast majority of you are. We encourage you to sign up for that. And with that, I will turn it over to I know we've got Jenny and Quinlan from K-State Research and Extension, but also some other partners working with the Heartland Regional Food Business Centers. So if there are any updates related to that program, I will let you guys share with us.
Yeah, thank you. I'm going to give the update, and I told Quinlan to jump in if I miss anything. So that's the way we'll handle it today. So I know that everybody is anxiously awaiting Business Builder Awards, those that have applied. So the Business Builder awardees that we expect to hopefully be funded have been sent to the USDA. And we were told last week it would be between 1 to 4 weeks that we would find out. Considering that we got a recent executive order, we're just going to be waiting a little bit longer, we think. We just don't know. Hopefully it won't hold us up too much, but it's still business as usual. We don't expect things to shut down. We're not panicking over things we don't know. So just hold with us. Yesterday we were told that the center, though, is going to start trying to reach out to those that did not get their grant sent forward to the USDA to give them feedback also on what they submitted. So be expecting that possibly coming up. I don't have a timeline for when that's going to happen, but hopefully helping those businesses be able to move forward with the project or hold off, because we have the second and final round of the grant that's going to be available. And we hope to announce that at the beginning of March. The timeline's gotten a little shifted. And I do want to note that this second round is actually going to be the final round. We will be giving away the last of the 11 million total, so there'll be a little over 7 million available in this round. So it's still the same amount of money. We're just combining the second and third round together. So we have more time we've done some editing to the application. No major edits, but some things are changing to try to help it help those applications be a little better in the sense of getting the information we need from applicants, and then hopefully making it easier for you. You know, it's just hard to do that, but we're doing our best to make it accessible for everyone. So there will be some minor changes in the application, but the overall grant won't change. What the project is won't change. So if you've had a project in mind, I would also say our Kansas clients, our Kansas businesses, they brought it and they did a really great job. Kansas had the highest scoring grants out of the region. So it is very competitive. And you all did a really great job. So thank you for all your support. If you helped with TA or if you're a business, great job on writing those grants. You did a great job. So I think that is all. Quinlan, was there anything else?
I don't have anything else to add, Jenny. Thank you. But we will take questions if there are any.
And we can put our information in the chat too, like our contact info in the chat. I'll put my email and Quinlan can put their email. And then you can reach out to us. Our clients have been reaching out to us, especially after news yesterday. And so if you want to reach out to us as well, that's fine, but you'll get the same message. So no need to if that's your only question. So.
Thanks, Jenny and Quinlan. Eileen, I see that you have a question for.
Yeah, so just to make sure I heard correctly, the total funding amount is going to stay the same. You guys are just going to move it from 3 application rounds to 2.
Correct. Yeah, it's because we have to have the grant completed by a certain time frame, and since we were doing edits, there was no time to edit it and improve it. So then we had to get rid of the third round in order to make that happen.
Okay, great, thanks.
Any other questions for Jenny or Quinlan? I know, Tom, you're on as well. I didn't know if there's anything from Kansas Rural Center that you wanted to share related to the business builder or anything else.
I don't think I have any updates. So I think Jenny and Quinlan did a good job summarizing where we're at. So thanks for that.
Okay. All right. So with that, we are going to open it up more generally for discussion or questions. This is a great opportunity to share, you know, if you've received grants that you're starting projects on, if you're working on applying for grants and looking for partners, if you've got upcoming events that you want to share out with the group, you know, things that you'd like us to cross promote with all of our respective contact lists and networks. All of those things would be great to share out to the group. And I'm actually going to stop sharing my screen so that we can more easily see folks if they want to unmute.
I can go ahead and get started. Just a quick announcement about our local food fellows, and we have a number of partners that have started the hiring process for our first round of local food fellows this year. We'll have 18 of them across the state, and there are currently 5 of those positions that are still accepting applicants to fill the fellow role. So those positions are listed, the job descriptions are on our website. And if you are, have folks in your sphere of influence that might want a part-time 320-hour fellowship opportunity this spring or summer, those are posted there.
Thanks, Amanda. Eileen, I see you've raised your hand.
Yeah, I just put a link in the chat to a new USDA funding opportunity you all might be interested in. It's the Urban Agriculture and Innovative Production Grants. And I know we've had a couple of these awarded in Kansas in the past, but I'd love to see more. And so just wanted to offer that if anyone is interested, the KU Center for Public Partnerships and Research provides funding for grant writers. So please don't be scared about applying for a federal grant. Please reach out to me and I can help connect you with KU and grant writers to support that. So if you're interested, I will put my email in the chat.
Thanks, Eileen. Brienne, I see you shared in the chat about the Cultivate KC Farmers and Friends meeting. Do you have anything you'd like to share?
Not much more than what you'll see on the website, but I am really excited about this being our 20th anniversary. And our keynotes are Tafira Rushton and Patrice Brown, and they're coming from Detroit, where they serve as the Director of Sustainability and Assistant Director of Urban Ag. So we're hoping to learn a lot from them.
Thanks, Brienne. Michelle, I see that you've got your hand raised.
Yeah, and just kind of another funding opportunity. Some of you may have heard of the Thriving Communities Grantmaker Program. The application is available. The first deadline is this week, but it's cyclical. So the next application cycle will be February through April. And it is access to federal funding. That's a little bit easier. The application is really straightforward, really easy to navigate. I'll put the link in the chat for that. And then if you need any kind of support walking through that, we can help with that. We can't write the grant, but we can help walk through it. And we do have some grant workshops coming up that will walk through this specific application step by step coming up soon. So I'll put the link to the grant opportunity and the link to the workshops in the chat along with my email. So if you have any other questions, give me a holler.
Thanks, Michelle. Is there anyone else that has something they'd like to share about? So this is kind of the start of heavy grant season for a lot of local food programs. So hopefully a lot of those RFAs will be coming out in the next couple of months. Lydia, I see your hand. Feel free to unmute.
Hi there. I just noticed with the next date of the town hall being April 30th, KC Farm School will have 2 plant sales by then. And so if anybody needs some organically grown transplants for home, we also can do wholesale for growers. And that's at KC Farm School in Kansas City, Kansas.
Thanks, Lydia. Yeah, I see Carrie mentioned in the chat that they have pulled down a number of USDA RFAs that were already announced. So there is a certain amount of uncertainty with some of those projects, moving forward. Kind of hard to know at this point exactly what the timelines might be. And I think for anyone that's been kind of in these cycles before, sometimes there can be some delays in those RFAs when there's an administration change, you know, and it takes a little longer than some years for things to get sorted out and put out and things like that. Anything else going on? Any other questions that have come up for any of our presenters or about any of the announcements or upcoming events? Okay. Well, if you think of something again, feel free to drop it in the chat. We'll just run through a couple of closing activities. So for our evaluation, and we appreciate your feedback in this because it does help us with our grant reporting. And so I'm going to launch our closing poll. So first question is if you learned something new today. Totally okay if you're not sure if you learned something new. Yes, no, or I'm not sure. What speakers or topics were valuable, and you can choose multiple. You can choose all of them. You can choose none of them. Things like that. And then the last two questions are if you have people that how many people you'll share something you learned today with. And any speakers or topics that you would suggest for our 2025 town halls.
And please, if you think of a speaker after this meeting, we are always accepting your suggestions. So feel free to reach out anytime and share those with us.
You can also recommend yourself as a speaker if you've got
Absolutely.
a neat project or opportunity that you'd like to share about. So I will leave the poll open for just a little longer for those that are maybe still thinking about speakers or things like that. But for everyone else, thank you again for joining us today. We're glad to have you with us. We hope you were excited to learn about our projects that are going on and those opportunities. So thanks again for joining us, and we will see you at the next town hall at the end of April, if we don't see you before in person or in another meeting. Thank you.